name is Mary Ann Lewis. I am 52 years old. I am a retired seamstress, and I was diagnosed with breast cancer about 8 months ago. I just finished my last round of chemotherapy, and I am now officially cancer-free. But I have been experiencing some numbness and tingling and shooting pains in my hands, and especially during grabbing small objects. And this has been a really difficult challenge for me because since I was a seamstress for so long, I also took up crocheting as a leisure activity, and I haven't been able to hold my crocheting needle. And also, I can't hold my dog's leash anymore because I can't grip it and it hurts my hands to hold it. So I've been having a lot of trouble with those two things, and I'm hoping to get a little bit of help here today.
Hi Marianne, and hi Millie. I'll be your occupational therapy student for today. So I hear that you've had some problems with your hands. Can you tell me a little bit more about that?
Yeah, so I've been having a lot of numbness and tingling sensations in my hands and my fingers. And it's especially bad when I try to hold little items like Millie's leash or especially my crocheting needle. It almost feels like an electric shock when I touch it. And I get these kinds of sensations every time I hold small items, so it's really impacting a lot of different things about my life.
Peripheral neuropathy is a condition that develops as a result of damage to the PNS. It affects the distal parts of the body, and typically patients experience numbness, tingling, weakness, and burning pain. Peripheral neuropathy can be caused by a number of conditions like alcoholism, diabetes, trauma to nerves, tumors, or autoimmune diseases. According to her charts, the cause of my patient's peripheral neuropathy was medications used to treat her breast cancer. Chemotherapy-induced peripheral neuropathy, or CIPN, is a common side effect of cancer treatment. Though chemotherapy is used to treat off cancer cells, sometimes it affects the peripheral nerves that connect to the spinal cord. The likelihood of a patient developing neuropathy post-cancer treatment is 70%. The development is highly based on what medications were administered. Typically, PN is diagnosed by a doctor performing a full medical history and examinations involving blood tests, electromyography, or a nerve conduction study. In my client's case, she actually met with her oncologist to discuss her symptomology and was referred to a physiatrist. The physiatrist clinically diagnosed my patient with CIPN, and she was referred to OT services for a full evaluation and treatment. Okay, so since you answered yes to all three of those questions, right now we're going to move on to the diagram portion. So just mark an X to the area where it hurts.
Okay. It's right here and here mostly, and a little bit up here.
Okay, thank you. Okay, so next I want you to rate your pain on a scale of 1 to 10, with 1 being no pain at all and 10 being as bad as you can imagine. So please rate your pain that describes your worst pain within the last week.
I would say like an 8.
Okay, and please rate your pain at its least in the past week.
Like a 2.
All right. And please rate your pain that best describes your pain on average.
Probably a 6.
And lastly, please rate your pain by telling me how much pain you are in right now.
A 3.
3? Okay. And what kinds of things make your pain worse? For example, like walking or standing or lifting?
Holding things tightly, like keys, that makes it worse. It's usually worse at the end of the day, and like I said before, like holding the leash and doing things like that, they make it pretty bad.
All right, Marianne, so what I have for you today are some gloves, These gloves have touchscreen capabilities, so that way you can use your devices still, but what they will really be helping you with is covering your skin so that way it can dull the pain and the sensations, and also just decrease some of the pain intensity that you've been experiencing. So why don't you try these on. Okay, that's on that side. Now up you. There we go. How do they feel?
Good. They fit well.
All right. Okay. So what we're going to do now is just try and see how you feel walking your dog, holding the leash, just so we can see how well the gloves are working out for you.
All right.
Okay.
Awesome. Millie, come here. This one's a little bit difficult.
Just take your time. How does your hands feel?
It doesn't hurt as much, so that's good. Okay. You ready to go?
Okay, so I know that it's going to be a little bit challenging crocheting with gloves on.
Mm-hmm.
So I recommend using a crocheting needle with a rubber handle. So why don't you give that a try?
Okay.
I'm going to take the metal handle out. So that way you don't feel those painful sensations that you have with the metal handle.
Okay. Yeah, it definitely feels better already. Yeah, that works a lot better.
Okay, great.
Definitely, I'll be able to crochet again.
Nice. All right, so tell me how the gloves felt when you were putting on your harness and the leash on Millie.
It felt a lot better. Usually when I put her leash on, I have to take a lot of breaks and let the tingling go down before I keep going. But I felt like I could just put it on continuously without stopping, so it went a lot quicker.
Nice, that's great to
good.
hear, yeah. So what we're gonna do is work on some therapeutic exercises for your hand, just kind of build some strength. So I'll coach you through that. So the first is working on some aerobic exercises, which will help with your peripheral neuropathy. So what I just recommend is that you take Millie out on a walk at least 30 minutes a day for maybe 3 to 4 times a week. Secondly, we are going to work on some hand strengthening using some exercises that I will show you next.
Okay.
So the first exercise we're going to work on is just laying your fingers flat on a surface. You can do this standing or sitting. And just lift up your index finger twice and tapping it. And then you're just going to repeat with each finger following it. And you're just going to do this about 3 times all around. You're doing great. Okay, so the next exercise we're going to do is you're just going to grab hold of the ball right there that Millie is sniffing at, and you are just going to put it in between your hands and roll up and down towards each finger to the end of the hand. Yeah, and this is just supposed to stimulate the receptors in your palm. So what I recommend is that you just do this for about 10 seconds and then, maybe rest for 5 and then do another set of 10.